Thank you, everyone, and thank you for joining this webinar by the Public Health Law Center. I'm Luke Huck, and I'm a staff attorney with the Center's Commercial Tobacco Control Team, and today's webinar is on the cost of access, raising the price of tobacco products. To give you a brief background on the Public Health Law Center, the center is located at the Mitchell Hamlin School of Law in St. Paul, Minnesota. We are additionally located in the indigenous homelands of the Dakota people, also known as the Sioux Nation, where there is a resilient and thriving indigenous population working to reclaim and revitalize the land and to strengthen the community. We are made up of a dedicated team of attorneys, policy analysts, and support staff who work nationwide on public health policies in the area of commercial tobacco control, healthy eating, active living, and climate justice. How the center goes about enacting our principles is through our work, including webinars like this one. We provide legal research, assistance with policy development and implementation, as well as publications and trainings. We offer educational information, model policy resources, research, and analysis. We don't lobby, however, nor do we provide legal representation or advice. Our understanding of health is broader than only physical health and encompasses overall well-being. In addition, we know that health and well-being are affected not just by biological factors, but rather can be shaped by the social, political, and other structural conditions in which people live. To speak to our core values, we seek to put equity at the center of our work. Part of what centering equity means is appreciating that people face different opportunities, barriers, advantages, disadvantages, and conditions in life. Equitable solutions often prioritize or give special concern to those who are already comparatively disadvantaged. In an equitable society, something like one's race or sex should not be predictive of one's health, happiness, or ability to thrive. Finally, I will also note that when we talk about tobacco, we're specifically referring to commercial tobacco products, which does not include the important and traditional sacred use of tobacco in sub-tribal communities. It's now my pleasure to introduce Carolina Saavedra. Carolina is also a staff attorney with the Center's Commercial Tobacco Control Team, and she's specifically part of the national and California teams. And today she will be presenting on tobacco product pricing and the value of increasing pricing. With that, I'll turn it over to you, Carolina.
Hey, thank you, Luke, for that introduction. Yeah, as Luke said, I am here to discuss the topic of tobacco product pricing, why increasing those prices is good, equitable public health policy, and the legal and logistical considerations for implementing such policies. Now, as everyone here knows, I'm sure, commercial tobacco use remains one of the leading causes of preventable death. Per the American Lung Association, commercial tobacco kills over 500,000 people in the United States. And while there have been significant improvements in commercial tobacco control and prevention at all levels of government in the last several years, and so many public health organizations and government agencies have had extensive education and awareness campaigns, commercial tobacco use and the harms it causes to public health and the environment continue to persist. And one of the main factors for this persistent problem is the widespread accessibility of these harmful products. The widespread access is apparent through the proliferation of tobacco retailers, the ubiquitous advertisement of these products, the predatory marketing and design practices employed by the tobacco industry, which include the availability of a wide variety of inexpensive tobacco products, which is what we will be discussing today. So it really is a fairly simple concept. The cheaper the product, the more accessible it becomes to a wider variety of people, especially among price-sensitive and industry-targeted populations, such as youth and low-income people. When tobacco products are affordable, it is a lot easier for young people to experiment with smoking, vaping, or other commercial tobacco uses, and to become more established commercial tobacco users. This low prices that also make it more challenging for those who are currently established users of tobacco products to actually quit or to reduce their frequency of use, even if they would like to. The extremely low price of sample size products, such as those that you can see on the photo on the screen, also make it, more likely that people will, be more likely to purchase them as a last minute impulse buy, and experiment with them in that way as well. So basically, the availability of cheap tobacco products, it leads to increased commercial tobacco use. Um, and the inverse is also true. The higher prices make tobacco products less accessible, which means that it leads to a reduction in commercial tobacco use overall. And this is evidenced by many academic studies that have conclusively shown that when tobacco products are made more expensive, fewer people use those products, fewer people initiate and start using them, and more people who already use them are likely to quit using them. And this is, as I said, particularly the case for price-sensitive populations like young people. Research studies have found that youth are 2 to 3 times more sensitive to price increases than the population at large. And for every dollar that is added to the price of a pack of cigarettes, for example, the likelihood that teens would become more serious or established, people who smoke, is reduced by about 24%. And this is a study by Slater and Wakefield that was done, I think, of last decade. Now, other studies also show that communities of color sometimes are also more likely to respond to price increases. Notably, after state cigarette tax increases were adopted, calls to quit lines for those respective states also increased. And the chances of quitting success, particularly with low-income and racially diverse populations, was significantly improved. So there was another study that showed this back, I think it was like over the course of 20 years or so. The tobacco industry knows this, of course, and because of this, they target these communities with reduced prices, cheaper products, and promotional discounts or coupons. For example, price promotions for menthol cigarettes tend to be more prevalent in neighborhoods that have higher concentrations of Black youth. So essentially, price increases are effective because less affordable prices means decreased access to those products in the first place. And the additional expense that is created by those higher prices encourages quit attempts, particularly among low-income consumers and youth. This resulting use reduction also leads to reduced healthcare costs from the health harms associated with commercial tobacco use, and tend to reduce also the unmitigated health harms as well. Increasing the price of tobacco through taxation, whether state or local, has the added benefit to generate revenue that can in turn be used to fund commercial tobacco prevention programs, and to make cessation resources and treatment more accessible to a wider pool of people. Price increases are also, can also be made more politically palatable for the wider public than maybe other types of sales restrictions, particularly where public health goals and the harms from commercial tobacco use are clearly articulated and communicated in advance of adopting the policy. Importantly, price increases also have the effect of narrowing the demographic gap in smoking prevalence, because price increase policies have the most impact on the health of the very same groups that have been traditionally and relentlessly targeted by the tobacco industry through aggressive marketing practices. In fact, a 2021 study on the impact of tobacco control intervention on socioeconomic equity found that increasing the price of commercial tobacco was the most effective tobacco control policy for reducing tobacco use disparities. So again, price increases are effective because less affordable prices means decreased access to tobacco products. And for this reason, price increases are good and equitable public health policy tool. Now, the tobacco industry, of course, is aware of this, and they have made price accessibility a significant component of their business model because it directly affects the level of consumption of their products. Indeed, tobacco companies spend considerably to decrease the price of their products in order to counter state and local tobacco control efforts, to appeal to price-sensitive consumers and to increase demand for tobacco products in general. For example, in 2020, tobacco companies spent the majority of their cigarette marketing budgets on price discounting strategies, accounting for roughly 89% of their $9 billion advertising and promotional expenditures for that year. The industry also spends vastly on lobbying to fight off legislation that would raise the price of their products. In California, for example, the industry spent about $71 million to oppose a 2016 ballot initiative that would have increased tobacco taxes. And in 2018, they also spent over $17 million to oppose a similar initiative in Montana. Now, more recently, an in-depth industry document analysis by Dr. Stanton Glantz and Dr. Dori Apollonio from the University of California, San Francisco, found that since the year 2000, tobacco manufacturers have been lobbying state legislatures to amend how they calculate minimum price loss and to ensure that manufacturer discount promotions would continue to be allowed as an industry practice. And of course, the aim is to have the ability to maintain, to lower prices strategically. Dr. Glantz found that as of 2020, 20 states had amended their laws accordingly. So aside from aggressive lobbying, we also see the introduction of poison pills to drafted legislation that seeks to include price increases, but also or tax increases, but also other types of tobacco control measures. And what these poison pills look like are, for example, preemption provisions that seek to basically hamstring the ability of local governments to enact their own more stringent tobacco control laws locally. Right? So that then that type of bill becomes less desirable for public health advocates and loses that type of support, or at least redirects the conversation as opposed to trying to garner support for a previously well-crafted bill, but now trying to prevent the introduction of preemption so that it's less likely to get support overall. Another similar poison pill type of measure are PUP laws, which are those that penalize the purchase, use, or possession of tobacco products by consumers. And those are also a non-starter among equity-minded public health advocates. So also publicly, we see the industry pushing many red herring arguments that saying that price increases are inequitable or that they encourage contraband products. So I want to kind of break those down for you a little bit. The inequity argument, for example, centers on the fact that price increases, whether tax-based or not, are regressive in the sense that people with lower incomes would have to spend a greater portion of their income on those products, so tobacco products, than those who have much greater disposable income, right? So that it has a disproportionate burden on low-income consumers. Now, there is truth to that argument, of course, but the framing is extremely skewed, right? Studies, as we have talked about, have shown that the price increase is precisely the motivator, or one of the motivators, for people to want to reduce the amount of products that they consume, or at least reduce the frequency of their use, and to also increase their attempts at cessation. And that reduction in use leads to, of course, less inequitable health outcomes, less expense on the medical care to deal with the health harms of tobacco use. Another way to dispel that red herring argument is that tobacco use itself is regressive, because the cost of tobacco products, even the cheap ones, is still, a substantial amount of money that is spent, and a greater proportion of the income of persons with lower income, for a product that kills half of its users when used as intended. And this is, of course, not counting all the other expenses that are directly caused by those products, like the increased doctor visits, medication, the unmitigated harms to one's health and to the health of family members, for example, from second and third-hand smoke. And so, these types of harms are a burden that is disproportionately borne by the populations, or the very populations whose pockets the industry claims to be so worried about. Now, while some increase in contraband products may happen, there isn't really evidence to show that this is a significant amount, and the public health benefits for price increase policies definitely outweigh those concerns. So just to sum up, the tobacco industry's extensive use of price discounting schemes is itself strong evidence that price has a significant impact on overall tobacco use and youth initiation. So, it is not a coincidence that tobacco products are often the cheapest in the lowest income communities. So we should not, allow the industry to make those red herring arguments to get away with continuing this predatory practice. Now, the industry uses a variety of price reduction strategies to discourage current tobacco users from quitting, as we said, and to entice new consumers to purchase their products and to reduce the effectiveness of tobacco product taxes or other price increase measures. So these include popular discounting schemes like dollar off promotions, multi-pack offers, such as 2-for-1 deals, or buy some, get some free. The tobacco industry also uses sophisticated research to apply these strategies to specific products in particular geographic locations or to target specific groups of people. For example, coupons are distributed in person at events or at venues chosen by the industry based on the type of event or the type of audience. Coupons are also sent via direct mail, and they can be targeted to particular areas, or they can be made available via download from the internet or smartphone applications through certain websites or apps. They're also targeted to, these are targeted to specific community areas, right? Like I said, lower income neighborhoods or to demographic groups like youth or minorities. Coupon distribution, redemption, and multi-pack discounts, of course, all have the effect of directly reducing the price for the consumer at the point of sale. But there are also indirect ways in which the industry engages in price deflation. For example, through trade discounts, which are given by manufacturers to the distributors at that point in the commercial chain. And the goal there is to make those products cheaper for retailers to acquire, which ultimately would allow for lower prices at the point of sale as well. Another example are competitive price matching programs, which tend to drive prices down by allowing vendors to sell certain items at below cost. And the effect of doing that basically it lowers the retail prices across many retailers, which is particularly concerning in areas that have high retailer density, which unfortunately tend to be primarily lower income communities and communities of color. So what are some strategies that public health advocates can use to combat targeted price deflation by the industry? Well, tax increases are a great tool. Taxation not only has the effect of increasing the price of the product, but it also has the added benefit of creating additional revenue, which should then be dedicated to funding tobacco control efforts and to increasing cessation access, cessation support and therapy access. However, the power to tax is generally within the purview of the federal and state legislatures. And in many instances, the local power to tax may be limited in some states, right? So you can reach out to us if you need to find out about your particular jurisdiction. Currently, federal tobacco excise taxes remain very low at $1.01 per pack of cigarettes. Federal tax rates for other tobacco products are, tens of times lower, such as, for example, for chewing tobacco, and the federal government doesn't even tax e-cigarette products at the moment. And although several bills have been introduced to do that, none have passed so far. State legislatures also have the power to tax tobacco products. How or if this is even done varies significantly across states, right? For certain products, particularly e-cigarettes. For example, New York has one of the highest tax rates for cigarettes, which is at $5.35 per pack of 20 cigarettes. And then on the other end, you have Missouri, which has one of the lowest tax rates at 17 cents per pack of 20 cigarettes. So, very big gap right there. And currently, not all states tax e-cigarettes. We do have, on our website, we do have a site, and maybe Stephanie can put it in the chat later, that you can look at different states and how they address e-cigarette regulation, including taxation. Now, only about slightly more than half of all states, tax e-cigarettes, at least comprehensively, and some of those are still very limited. I'd like to, give an example of Wisconsin, and not to pick on Wisconsin, but they are taxing e-cigarette devices, which is it's a really great step. However, the way that they defined the term vapor product, it basically only includes devices that have the heating element within them. So if you, for example, are buying just a refill cartridge for e-liquids, that wouldn't be taxed. Now, for local governments, such as cities and counties, whether they can impose their own excise taxes on tobacco products depends largely on whether their state legislature has delegated some of that taxing authority and to what extent. Now, sometimes they just don't have that authority, right? And even where local governments have the ability to tax generally, their ability to tax tobacco products specifically may have been curtailed by their legislature through preemption, largely at the behest of the industry. For example, California localities have some of the greatest authority to enact commercial tobacco control measures at the local level. However, the California legislature also explicitly preempts any local tax on the sale, promotion, distribution, or use of any tobacco products. Now, for those local governments that have the ability to tax tobacco products, taxation can be a great tool to increase prices by layering their own taxes on top of the state and federal ones. And so I'd like to give Chicago as an example. Chicago has a tax of $1.18 per pack of 20 cigarettes, and that is on top of the $2.98 state tax. Plus, they also have the county tax that is also rolled in. That's at $3. And then, of course, when you add the federal tax of $1, you end up with a much higher tax rate for cigarettes. Now, unfortunately, the city of Chicago does not have the authority to tax other tobacco products aside from cigarettes, as was determined by the court there. But we are seeing more and more local governments that impose their own taxes on e-cigarettes. For example, Montgomery County, Maryland imposes a 30% tax of the product's wholesale price, and Anchorage, Alaska imposes a 55% excise tax on e-cigarette products. However, taxation, of course, is not the only way. There are other non-tax strategies, which include price floors, which basically means that the state or locality would set a minimum price for a particular product. These base prices, would also need to be coupled with minimum product sizes, to ensure that if you buy larger quantities, you're not getting a discount, right? So basically tied to a per unit pricing, for example, for each additional unit. So it's not, to fall into that trap. These types of price floor policies started out as laws that were meant to prevent unfair trade practices that injure competitors by artificially reducing the price of products. Most states have some sort of unfair trade practice pricing restriction. And these are often based on the manufacturer list price and can sometimes factor in any trade discounts provided to distributors or wholesalers. So there's a lot of room for, moving pieces around, right, by the industry. Now, many states also come up with a numeric formula to apply to each specific brand and type of product. And usually they have these published somewhere within their government website. However, these types of laws do not tend to have significant price increase effect overall, because that's not their purpose, right? And manufacturers, do list lower prices in states that have greater taxes and follow this type of formula. However, states and also have the authority to set minimum price laws for public health reasons. And some local jurisdictions sometimes can also do that as well, depending on how much preemption there may be. And the goal for those would be, of course, to reduce the saturation of accessibly priced tobacco products. For example, Colorado has a minimum price for cigarettes of $7 per pack of 20, which will go up to $7.50 after July 2020. And then San Diego County in California, they can't tax these products, but they have set minimum prices for different products. Like, for example, cigarettes and little cigars at $20 per pack of 20, which is what the Surgeon General recommends. Cigars at $5 per cigar, e-cigarettes at $20 per device, and e-cigarette starter kits, which contain the e-liquids, would be at $30, right? PHLC, we also have a model policy for minimum price setting. We have model policy language for minimum price setting strategies across tobacco products, and those are found within our state-specific tobacco retailer license model policy samples, but they could potentially be adapted to other jurisdictions, as long as it is permissible to do that there. And these are all available on our website as well. Now, prohibiting redemption of price discounts of products is another good way to have a non-tax strategy for price increases. Because these would also, of course, complement any minimum price loss, because it would prevent the industry from working around your price increase strategies by simply just offering coupons and discounts at the point of sale. And yeah, I think I lastly included like a brief mention of disposal fees or litter abatement fees, and that, as far as I know, has only really been done in San Francisco. That was meant to abate the cost of tobacco product waste from cigarette butts, cleanup in the city. And right now they have a 20-cent per pack, charge, which is it's not a very significant amount, so it doesn't necessarily have that effect. But it is there in case it is possible for other jurisdictions to kind of follow suit. Unfortunately, for other California jurisdictions, after San Francisco passed that measure with the litter abatement fee, the industry pushed for a ballot measure that expanded the definition of what is considered a tax in California, and therefore any subsequent jurisdiction that would want to enact a similar litter abatement fee would be prevented from doing so, because it would likely be considered a tax. Now, states have a great broad legal authority to regulate the sale and distribution of tobacco products within their borders. If regulations are carefully drafted to focus on tobacco product pricing, retailer conduct at the point of sale, and transactions within the specific jurisdiction, these pricing laws are very likely to be upheld, even when they are challenged by the tobacco industry. While many local jurisdictions also have this authority, many states have unfortunately preempted, as we mentioned earlier, that their local governments from enacting these sorts of policies. So it's important to note that this has been intentional. The tobacco industry has lobbied aggressively for states to preempt local governments from enacting local regulation of tobacco products, including the power to enact taxation, and several other states also preempt local taxation of tobacco products, as we discussed earlier. Now, if local jurisdictions do not have the authority to directly regulate the price, the price of tobacco products, either through tax or non-tax strategies, they may want to explore opportunities to maybe just enforce existing state minimum price laws and make sure that at least they have that option. For example, a state's minimum price law could allow for prohibiting the redemption of certain coupons that might reduce the price of cigarettes below the statutory minimum. So that may already be there within the state law, and so that may be another tool. Although it is very constrained if there is heavy preemption in that sector. Now, for any jurisdictions that are considering looking into these price increases, it's going to be very important to find out, of course, what kind of local authority your jurisdiction might have to be able to enact such types of policies. So if you need help or technical assistance, as Luke said at the beginning, you can reach out to us and we can research that issue for your state. No, the industry has also directed litigation challenges that are based on federal preemption and First Amendment commercial speech claims to some price increase policies in the past, but so far they've been unsuccessful. So, for example, in National Association of Tobacco Outlets v. City of Providence in 2013, the industry challenged the city ordinance that prohibited the redemption of coupons for tobacco products. It argued that the ordinance restricted cigarette promotion and that this was preempted by the Federal Cigarette Labeling and Advertising Act. The federal district court found that pricing ordinance, the pricing ordinance from Providence did not impose additional requirements on labeling or advertising of cigarettes or on the content of promotional materials for cigarettes, but that it only regulated the sale, and so therefore it was permissible and not preempted. The First Circuit Court of Appeals affirmed the decision under slightly different reasoning, basically finding that the ordinance did regulate the promotion of cigarettes, but did so under the federal law's exception for content-neutral time, place, or manner restrictions, and therefore it was also not preempted by federal law and did not breach freedom of speech. The court also notably declared that regulating coupon redemption was not materially different from other price restrictions, such as minimum price laws that the industry had already conceded were not barred by the federal act. Similarly, in National Association of Tobacco Outlets v. City of New York, in 2014, so just shortly after the first case, the industry also challenged an ordinance that restricted the sale of tobacco products below the advertised price. It also set a price floor for cigarettes and little cigars, and it prohibited multi-pack discounts. The industry challenged it, arguing that the ordinance was a violation of its First Amendment right to commercial speech and that it was preempted by the Federal Cigarette Labeling and Advertising Act, right? So the same kind of claims as they did in Providence. In the Providence case. The court there granted summary judgment for the city in its entirety, holding that the federal law allowed the states and localities to pass restrictions on the time, place, and manner of advertising or promotion of cigarettes, and that the ordinance lawfully regulated only that manner, right, of promotion. In other words, it was regulating an economic transaction is basically how the court put it. And it didn't regulate promotional content, and so it did not violate commercial speech. The Second Circuit Court of Appeals also held that in order to violate the First Amendment, the ordinance would have to restrict the dissemination of the pricing information in the first place, right? So, for example, the distribution of coupons. So basically, the key takeaway here is that at least two federal circuit courts have held that local jurisdictions or states are not federally preempted from regulating the pricing of tobacco products and may even restrict the redemption of coupons. However, restricting the distribution, right, the mailing out or just passing around of the coupons themselves, that would face stronger challenges. For local jurisdictions, having no federal preemption for this type of tobacco control measures or pricing measures is really only half the concern, because as we stated earlier, it may be that many states might have their own state level restriction of local authority when it comes to these types of regulations. So that should always be a consideration. Okay, so basically let's just briefly cover the vehicles that are available for implementing these types of price increase measures. We have some non-tax approaches to tobacco price increases, such as minimum price laws, as we said, discount restrictions, coupon redemption prohibitions, etc. And these can be enacted through a standalone law, right? Either a statute at the state level or an ordinance at the local level. Or they can be enacted as part of a tobacco retail license requirement, basically folding into that paradigm and making it a condition to be able to retain or renew your license. The tobacco retail license approach is certainly preferable because it would already have administrative and enforcement mechanisms in place, which would make it a more a simpler and more efficient process to implement and to monitor for compliance, right? It is also more cost effective if you already have that system in place. However, not having a tobacco retail license ordinance or chapter within your code already in place, or not having enough community buy-in to be able to enact one, should not deter jurisdictions from seeking to regulate pricing anyway, even through a standalone provision within their general tobacco, local tobacco control regulations. So for tax, there are generally two approaches to taxing tobacco products. One is, doing it kind of per weight. For example, like, a lot of places will tax a pack of cigarettes basically per pack of a minimum number of units, right? 20, for example, or they could also do it per weight, such as per 1,000 grams of cigarette weight, and then apply a dollar or a dollar value to each of those. Then there's also another way to do this is to do it through an ad valorem system, which is basically the percentage of the wholesale price, which may be a much simpler way to tax, for example, e-cigarettes, because there's such a variety of products and concentration of nicotine and everything else. So having a percentage of the sale price might be a way to address e-cigarettes, even though if you couple that, of course, with nicotine content, that's something the FDA would have to do, but that would be nice. Basically, doing it ad valorem is another way. It's not necessarily a bad way, but you have to just know that it would have to be coupled with some strict minimum pricing, right? To ensure that there isn't a way to go, for industry to kind of lower those prices in order to lower the effectiveness of your measure. And then, of course, you could have a combination of both of those, which may be the strongest way to approach it. Now, it is also important to allocate, if you're doing tax policy, to allocate the revenue to commercial tobacco prevention measures that aim to reduce use, of course. So, funding research and evaluation, funding policy development and education to the public and to retailers, funding cessation support, and funding of treatment for people who are willing to quit or wanting to quit. And again, tax revenue, it is the most equitable way to use that tax revenue, of course, is to use it in cessation services for communities, the specific communities that have been targeted and disproportionately harmed by the tobacco industry. So kind of fold in that equity piece into your policy as well. Now, finally, here are some general implementation and drafting best practices. Now, look, this is kind of generalized, and you would need to tailor it more when you're actually drafting an ordinance. And if you wanted, again, technical assistance with that, we can help. But here are some basically general principles that you need. So a purpose and finding section, which basically lay out the reasoning for your policy, like what is it seeking to accomplish, right? The public health reasons that are behind it, and of course the findings, which would be provide some of the data that would support that reasoning. Now, the purpose and findings don't have to be codified into the final code, but they should at least appear in your ordinance, as they will guide any adjudicators, if there's any legal challenge, right? And clear, comprehensive, and concise definitions of all the crucial terms within your policy, particularly each type of tobacco product that is going to be priced separately is going to be also important, and to ensure that there is parity in pricing across products, so that the policy doesn't simply just shift consumption from one product to another, right, based on the price point. If your jurisdiction already has a strong tobacco retailer license and requirement, like we discussed, this would help implementation, and compliance monitoring of the policy and make it more feasible. And then, there should be an adequate tobacco retailer license fee increase folded into that to be able to cover the cost of carrying out the policy of monitoring for the price, for the minimum price strategy that you have. Now, any penalties, of course, should be predicated on an equitable foundation. So for any, violations of your policy, any consequences should be focused on the licensee or the retailer, right, the proprietor, not on the employees or consumers. So it'll be important to revise that. And similarly, PHLC, we do not recommend criminal penalties for violations of tobacco prevention policies, either for consumers or for retailers. And finally, a well-crafted implementation process would include community engagement and education, as well as that, supportive investment in cessation resources in order to help with your public health goals. So I just want to close up by saying that, we shouldn't let the industry talking points frame the conversation about tobacco pricing policies and measures. As we discussed, the research strongly supports the conclusion that tobacco product price increase policies are good and effective public health policies that promote equitable results, right? By decreasing the frequency of use and increasing quit attempts and incentives for the very same communities who have been the target of the industry predatory marketing and sales practices. And so that's the end of the presentation. So I believe we have about, a few minutes for questions. We can stay a little bit longer if needed too. I believe I went a little bit long. So
Thank you, Carolina, for a great presentation. And we've got a handful of questions in the queue. So a first one we had is, how can you coordinate with other local governments when you have communities that border another city and can access tobacco products in the adjacent city?
yes, so that is a really good question because of course it's a consideration that if you are just within a very short driving distance to another place, you can go and get cheaper products. So I think that coordinating maybe with some of those other public health departments from your adjacent cities or within the county to be able to affect those unincorporated areas is probably, one of the best ways to go about it. And, because you can't change their laws, but you can coordinate and kind of educate them as to what you're doing, what you're trying to accomplish, and ensure that, maybe they would be willing to work with you. I believe that this is a scenario that probably happens across, several different local, laws that happen that, related to tobacco control, but also for other areas of law where there might be some coordination and some conversations that happen across the jurisdiction. So just kind of continuing to have those, and then kind of showing the findings, your purpose, like your data that you have with those jurisdictions as well, would probably further that cooperation, so that hopefully you can have a whole region that has similarly enacted policies to reduce that effect.
Thank you. We have another one about vapes. So what about vapes? This is a very cheap way to get nicotine and never seems to be in the price regulation conversation. Why are the prices of vapes regulated differently from cigarettes?
Yeah, so vapes are complicated because there is such a wide variety of types of products, of sizes, of content, and unfortunately, we don't have like a maximum or a ceiling, like a product standard for how much nicotine content can be. Sorry, in the products, and so it is challenging and it is complicated. However, there there is the ad valorem option of some kind of tying the taxing to the price of the product, and then you also have just a way to do it per unit, right? So you can do not just taxing, but also minimum pricing, or setting a minimum price per milliliter of liquid. that is within the product itself. So we actually do have some language, some sample language when it comes to pricing of the e-cigarette, how to set these minimum prices for e-cigarette products within some of our model policies. So, be happy to share if you want to reach out to me via email as well, But yeah, basically kind of tying it to, I guess, a liquid unit of measurement might be the best way to go about that.
Great. And it looks like we have three more questions if we have time for that. One is, would the California litter abatement preemption also apply to other tobacco products such as e-cigarettes?
Yes, yes. Unfortunately, the fee, the type of fee is likely to the issue is not like the cigarette aspect of it. It is the type of fee, the way that it is attached to each unit that is sold. The basically California amended its constitution to expand their definition of what is a tax, and so that those types of fees would be considered a tax. And because there could maybe be arguments that the preemption on taxation for tobacco products is on the use, promotion, distribution. Maybe there's an argument that this litter abatement fee is really a tax on the disposal of the product as opposed to the promotion, sale, use, distribution. But how likely it is to, an argument to be successful, that's a different question.
Is it more effective to do a statewide tax or the other local price restrictions such as coupons, discounts, or minimum prices? So I think, yeah, statewide versus local, which is more effective.
Okay, yeah, I mean, it really depends on what the legal authority is going to be for the local jurisdiction. So, if there isn't there, then having a statewide tax increase is preferable. But the state can also do local, can also do price restrictions and minimum price laws as well, right? And for whether one or the other is preferable. I mean, if you can do both, of course, that's the best, right? But having for localities that have a lot of restrictions within their local authority, what they can do, having the state would be preferable. So it really depends on that type of situation and what the ability is for the local jurisdiction to be able to regulate, whether through taxation or through minimum pricing. And if you have that ability, then definitely go for it, even if the state already has some taxation within it.
And just one more question. I don't know if we have information about this, but the question is, can you talk at all about taxing heated tobacco products?
Um, yeah, so heated tobacco products, they could be kind of folded into some of the model policies, or some of the language that we already have for some of the other tobacco products. I don't have like necessarily specifics on that right now. I'd have to think on it a little bit more. And again, you can reach out to me via email, and I can answer maybe additionally. But basically, yeah, like heated tobacco products could potentially also be taxed, whether it is taxed based on the price point, or simply because they're folded into the definition of tobacco products. Like a lot of jurisdictions might have or might choose to have a definition of other tobacco products, and then try to tax them that way, simply as an ad valorem kind of basis, based on the price of the product already. Or you could try to do it per unit, and that would have to be a little bit more specific in the wording of the language for pursuing a policy for very specific products.
Perfect. Thank you. Seeing no other questions, that brings us to the close of this webinar. Thank you for a great presentation, Carolina, and thanks to all of you for joining. We look forward to seeing you at the next one.